Hi, I'm Paul Gabriel Scullion, Director of Biomechanics Foot Laboratory, podiatrist and podiatric surgeon in practice here in Dublin. Welcome to this short video. It forms part of our series of videos on our webpage. Today we're going to deal with the troubling condition of painful neuromas. I'm going to show you a modification to perform exactly on your patient's orthotic device to accommodate this condition. You will need these following items: your prescription orthotic devices for your patient, a set of scissors, some semi-compressed felt with adhesive backing, also known as chiropody felt or orthopedic felt. You need a lipstick. You also need a water-soluble pen and some sticking tape. We want to know exactly where the most painful point for our patient's foot is. In this particular case, I'm locating between the third and fourth digits and between the metatarsal heads. We can ask the patient to confirm by palpating the area which is the most sorest point. When you've achieved the sorest point, you take a water-soluble pen and you mark it exactly on that area. You then prepare the padding by reducing it in size and taking a more neater profile. You can capture the fifth metatarsal, first metatarsal, and the webbing of the foot as well. Using a pair of scissors, we cut an exact U around this pad to capture the painful site. I also double up the thickness of this to provide additional support . I take my tape that I've prepared as well and I strap the pad exactly in place. The patient is asked to keep the padding dry and to keep the padding in place for 48 hours. Over this period of time, the padding will bottom out to a certain extent, but also the tissue that encaptures the most painful site will fill into this gap. That's the important thing that we want to capture. It is vital that the patient returns to the practice with the padding in place, and either you or the patient can remove the padding. Welcome back. The patient has now returned 48 hours later for a review of the foot. The first thing you want to do is confirm that the padding was in the correct position, and the patient can confirm this by stating how comfortable the padding was. If it's very uncomfortable and wasn't sitting right, you want to repeat this process for another 48 hours. This one was placed correctly. So I remove this pad and I can use some lipstick to clearly mark this area. The orthotic device is placed inside the shoe and the patient is asked to stand in the shoe barefooted. She can take a few steps on it as well, and that will clearly transfer the mark for us. The device comes out of the shoe and you can clearly see the mark that's left on the extension padding. You can now take a pair of scissors and cut this marked area cleanly out, like so. The orthotic device is now dispensed to your patient and they go through their normal breaking in process for the next 4 to 6 weeks. Be sure to have them back to confirm that the cutout has been doing its job correctly. I've had huge success with this conservative treatment for neuroma sufferers. I've been using it for well over 25 years. You can visit our website www.biomechanicsfootlab.com for additional educational videos.